Welcome to Pediatrics Code podcast. We were talking about important medical topics in a simple and interesting way. I'm Emily Suarez, and today we are going to discuss serious but preventable problem, shaking baby syndrome or SBS. Stay with me, this is important for anyone who takes care of babies. Well, first, what is shaking baby syndrome? Okay, imagine you are holding a snow globe, now shaking hard. What happens? The small pieces inside move fast and hit the glass. This is similar to what happens inside a baby's brain when they are shaken. SBS is a dangerous head injury caused by violent shaking. It can lead to serious brain damage or even die. Babies have weak neck muscles and soft brain, which makes them very vulnerable to this kind of force. What does shaking baby syndrome happen? Think of a tired parent, a baby crying non-stop and stress increasing. Sometimes out of frustration, a caregiver shakes the baby without realizing the terrible effects. Here are some common risk factors. First, young or inexperienced parents who are not used to caring up for a baby. Second, high stress or a lack of emotional support. Finally, alcohol or drug use or mental health problems. Knowing these risks can help prevent shaky baby syndrome. But how can you tell if a baby has been shaken? Well, the signs may not always be clear, but some warning signs include irritability, worse than usual, trouble feeding or constant vomiting, also seizures or breathing problems. The baby suddenly seems very weak or unresponsive. If you think a baby has been shaken, call emergency service right away because every second is important. The doctors diagnosed shaking baby syndrome by looking for 3 case injuries. First, subdural hemorrhages like bleeding around the brain. 2, retinal hemorrhages like bleeding in the eyes. And 3, brain swelling. The long-term effects can be very serious. Some babies may develop learning problems, seizures, blindness, hearing loss, or even cerebral palsy. This is why prevention is so important. And the good news? Shaking baby syndrome can be completely prevented. If you or someone you know is feeling stressed baby, a crying baby, here are some tips. First, remember, crying is normal. Babies cry a lot, but shaking them is never the answer. 2, take a breath. If you feel frustrated, put the baby in a safe place like a crib and take a deep breath. Also, you can ask for help. Talk to a friend, family member, or support group. And educate others. Babysitters, grandparents, and anyone who takes care of the baby should know about shaky baby syndrome. Shaky baby syndrome is a terrible but preventable problem. By learning and sharing this information, we can protect baby for war. Thanks for listening to Pediatric Code podcast. If you found this episode helpful, share it with others. Don't forget to subscribe for more simple and important medical discussion. Until next time, stay informed and stay safe. Bye.